Hi everyone. My name is Alan Simon. I'm the new director of NHANES, and I want to start by thanking you all for coming today, and to thank all of our collaborators and our potential collaborators. It probably goes without saying at this point that we can't do NHANES without all of you, and we appreciate everything that you do to make this survey work. But even though it goes without saying, I think it's important that we say this every now and then so you know how important you are to us. I want to introduce myself since many of you, if not most of you, I don't know. Um, I'm a pediatrician by training, and I did residency right here in DC at Children's National Medical Center many years ago now. And then went up to Johns Hopkins to do some research training for a little while. And then I came to the National Center for Health Statistics, where I stayed for 10 years in the Division of Healthcare Statistics, and then in what was the Office of Analysis and Epidemiology, now the Division of Analysis and Epidemiology. After that, I went to the Office on Women's Health for a few years, and then over to NIH, where I helped run a clinical trials network as part of the NIH ECHO program, Environmental Influences on Child Health Outcomes. So now I'm back here at NCHS. I'm very excited to help lead the team and help lead the survey as we go forward. Um, Unfortunately, it's hard to introduce myself and also be the bearer of a little bit of bad news, but there it is. As many of you know, we are ending a contract cycle, and David will tell you more about our timeline for that, but it means that we'll be entering a new contract cycle. The hard part is that we are having some issues getting our new contract in place. We've had some protests, and there's work to be done here, and as such, the survey schedule is delayed from what we would like. So our time getting back into the field with the new contract cycle is going to be a little further out than we'd like. At this point, we're thinking that we'd be back in the field in 2025. Initially, I think we had hoped it would be 2024, but it looks like 2025 is more realistic at this point. Now, for some of you, there's a little bit of a silver lining. For our non-CDC collaborators, we may be able to carry over money if you've already planned for your 2024 budgets. We might be able to just carry those over. Reach out to us individually to talk to us about that. And if this is going to cause a problem for you, please reach out to us individually. We want to work with all of you to make this as smooth as possible for everybody. Um, with that, we're going to save questions for the end, I think. So you can ask me whatever you like at that point. I think we're going to move on and hear from David and Chai, and they're going to tell us a little bit more about um, our timeline and our plans for taking new proposals, and also our process for the research data center. So one more time, I'm going to thank all of you for coming and for being collaborators with us. And I think that's it. David, why don't you take it away?
Hey, thanks very much, Alan. I appreciate that. And hi, everybody. And I want to echo what Alan said. I want to thank all of you for your support and interest in the survey. We couldn't do it without you. So what I'm going to be covering today is I'm going to be giving everybody a quick refresher sort of on the current cycle of the survey, and then where we are in our planning for what Alan has just said is going to be our 2025 survey. For our current cycle, we started for 2021. It began in August. And as for those of you who have been with us for a long time, typically we would start in January. Because of our having to re-gear because of COVID, we weren't able to start until August of 2021. But the survey still ran for 12 months, as it always has in the past. And so it completed 12 months later in August of 2022. And I know these dates start to all sort of run together after a while. The 22 survey of this cycle began immediately after 21, and it began in August of 2022, and it will end in August of 2023. So it's the same as it always has been. We're just a little bit more than about 7 months, a little bit more than 7 months from how we typically would have started and stopped this survey. Um, Our sample design is we're still attempting to get 5,000 people examined and through the trailers, through the mobile examination trailers each year. But to remind everybody, there was no race and ethnicity or income over sampling as there had been in the past. And this was typically because of it really reduced our touch points in the field with our field interviewers, because that when we had first gone back into the field in 21, that was a very significant point for COVID, and we were trying to limit that. Sort of the elephant in the room is that our response rates, we're not ready until this cycle is over to talk about the specific response rates, but I think, as you might expect, they are lower than what they had been pre-pandemic. And last I'm showing on, I don't know if I hope you guys can see it better on my screen. It's right at the bottom there. Sorry about that. Data release for this cycle for 21-22 is anticipated to occur in Q2 of 2024. Please know that we make every effort possible to release as soon as we are able, but because of various issues, we just want to make sure that we have everything right for this cycle. And so it's going to be in Q2 of 2024. Next, Lisa. So, all right, so now moving on to our 2025 solicitation for new content to sort of refresh everybody of what has occurred, where are we coming from, where have we come from. So we asked all the current collaborators to state their renewal intention by the 23rd, by May of 2022. And then new content, if for those folks who were proposing, you can see the dates there that the submissions were due for exam, questionnaire, and laboratory. So what we did is we took sort of these intention submissions, and then we invited folks to go ahead and submit new full proposals for exam, lab, and questionnaire. And I'm sorry, this is showing off the screen. I'm sorry about that. When we tested this, it wasn't showing off the screen. And you can see the numbers there. We invited and received 13 exam proposals, 7 lab, and 14 questionnaire proposals. So then this takes us to where are we right now? So right now we have completed our review. The planning branch within the division undertakes we are spearheading this effort, but it's a division process by which everybody in our division is able to participate. And so we do it first exam, then lab, and questionnaire. So right now with our exam, we have completed our individual reviews of all the proposals that have come in. And we sort of now take a step back, looking at it holistically, and we see about sort of how this is going to maybe be for the next iteration of the survey. So that's sort of where we are right now for those exam proposals. For our labs, we have completed that process too, but we're not quite at the holistic stage yet. We're going to finish up with the exams, then look at the labs and do the same thing there again, is to see where we are overall. And last is our questionnaire. We're about halfway through our review and discussion of the questionnaire proposals that we received, and we anticipate this finishing up in early December. So you see just a few more weeks and we'll be done with those reviews. Next. So then what's still to come? What's in front of us and where do we stand? The first thing is that, of course, like I just said, we need to complete the review of the questionnaires. And this next bullet here it says complete development options for exam and lab. Really, at this point, what we're doing is that we are going to take a step back after, again, we've looked at all the individual proposals for the exams, for the lab, and for the questionnaires. And we're making decisions sort of, on those individually, but then we also need to take a step back and really take a look at where the survey is overall. Lisa, can you hit that next bullet? And so it includes the current content as well. So for proposers who said they want to continue in the next iteration of the survey, we now need to take a look holistically at where we stand. We want to make sure that we're not too heavily weighted for certain age groups. We're taking a look at our times because obviously burden to the participant is significant. And so we just need to take a holistic look at all of this. Next, and then where we are is then we would be getting back to everyone on where we stand and what the decisions have been made. What we're looking at and what we are considering is if certain content may not, what I'll use the term fit in this iteration of the survey, we may be looking to say, hey, but could we possibly add this to a future iteration of the survey? Again, so much of what we are doing right now is our hands are a bit tied because of the contract situation that Alan has mentioned when he started off. We're doing everything we can internally within the division to move us forward to a place that once the contract is settled, we are able to move forward as quickly and efficiently as possible. There'll be obviously a lot of decisions and processes that would need to be taken place, but we're doing everything we can right now for what we can beforehand. So, as Alan said, we'll take questions at the end. I am now going to turn it over to my colleague Chai Wong, Dr. Chai Wong, who will talk to us about accessing restricted NHANES data through the RDC. Thanks very much.
Thank you, David. Good afternoon. I'm Jai Wang, team lead in the DHANS planning branch. I'm really glad to have this chance to discuss with you on the accessing restricted enhanced data through the NCHS RDC and how can we help in the process. Next, please. For the past 2 decades, there are more than 1,800 datasets have been made available to the public from the continuous enhanced since 1999. Majority of those data are publicly available. However, there are about 15% of them only available through the NCHS Research Data Center, the RDC as we call it. Next, please. To access this restricted enhanced data, we need to have an approved RDC proposal. In addition, person need to access the data need to complete the confidentiality training and sign the data user agreement and the designated agent form. The researchers has to also submit the non-NCHS data if merging to outside data is needed for the analysis. They also have to bring in any public NCHS data if those data are needed to be merged with the restricted data for the analysis. There are usage fees associated to the RDC access as well. However, as noted in the footnotes here, the survey funding collaborators have waivers for the $3,000 management fee and the on-site usage fee annually for the access. Next, please. There are 4 NCHS RDC locations, 3 in the Maryland, DC area, and 1 in the Atlanta CTC campus. Most of the NCHS restricted data in the RDC can also be accessed in the federal statistic research sites that are managed by the Census Bureau. Next, please. Once the analysis are complete, the output and the publications will be reviewed based on the RDC output policies and RDC publishing guidelines. You can find detailed information on this standard data access process in the RDC website. For each proposal, you will be assigned with the RDC analyst, and the analyst will be working with you and will guide you through those processes as well. Next. One thing I want to bring to your attention is there are 2 general categories of restricted data in NHANES. The first categories is data that could possibly disclose participation in the survey. For instance, survey locations and the exact interview and exam dates. And there are some characteristics or measurements we collected in the survey may have small cell sizes or resulting in rare combinations when combined with other items. And in addition, we restricted the single-year measurements to the RDC for the similar disclosure concern as well. And then there is a second category that is the enhanced protected data. Those are data containing sensitive information. For example, the sexual behaviors, sexual transmitted infection, drug use, adolescents, alcohol use, children and adolescents, mental health measurements, and certain selected household level measurements. And next, while the general RDC output policy must be followed for both categories, because the differences in disclosure risk, we do allow some exceptions for the data in the enhanced protected data group. For this category of restricted data, the output with cell size less than 5 or with extreme values such as 0, 1, 99, and 100 percentile may not be suppressed. However, these exceptions will not hold if analysis combine the enhanced protected data with other restricted data. Next, please. How often people request access to the restricted enhanced data? We look at the data from 2017 to 2021. We received about 40 to 60 proposals each year to request RDC access. And here are the numbers by year. Just as the clearance process we all very familiar with, the proposal review can vary quite a bit depending on the nature of each proposal. Next. Here is an example from one of our division's reviewers' experience. During 2018 to 2021, this reviewer reviewed 113 proposals. The x-axis here is the number of reviews each proposal went through. As you can see, about 2/3 of those proposals were completed with only 1 or 2 reviews. Of course, on the tail end of this, some proposals may be more complicated and were revised and re-reviewed quite a few times. Next, please. In the current RDC proposal process, next, the research first submitted the proposal to the RDC. Then an RDC analyst is assigned to the proposal and they initiate the proposal review process. Next, please. There are multiple layers of review process here, and those reviews are conducted sequentially. And there are multiple reviewers involved, including the reviewers from the data review division. In this case, is DHANS, and the reviewers from RDC as well as the NCHS Confidentiality Office. And the assigned RDC analyst facilitated the communications between the reviewers and the researchers. Next, please. Once the proposal is approved by all the reviewers, the RDC analyst will then contact the DHANS data steward to start the preparation of the restricted data set. And when the data set is ready, the RDC analyst will merge the restricted enhanced data with other data sets supplied by the researcher. For instance, any public use enhanced data and non-enhanced data needed for the analysis. Once the final data set is ready, the RDC analyst will contact the researcher to set up an appointment to come to the RDC to conduct the analysis. This is the current process for any researchers who wanted to access non-public enhanced data through the RDC. As I mentioned earlier, all the detailed information can be found in the RDC website, and the RDC staff are always ready to provide help to the researchers. In addition to this regular process, for our survey funding collaborators, we thought we could leverage the established working relationship you all already have with our division staff and probably make the process even more smooth. Next. Therefore, we work with our research data center and come up with a set of expedited RDC proposal review process. Next. In this alternative process, we ask you to submit the proposal to our division directly through the component project officer. This way, you are working with someone you are familiar with. The PO will make the initial review and forward the proposal to our division reviewer. Next, please. The PO will also facilitate the communications between DHAN's reviewer and the collaborator. The idea is, with the PO being knowledgeable of the restricted data use, he or she can assist the process and maybe help cut down the potential back and forth. Once approved, the DHANS reviewer will forward the proposal to RDC as pre-approved by data system. Next. At the same time, the DHANS reviewer will notify the division data steward to start preparing the required enhanced data set. For the collaborator using this expedited review, the data steward will provide both restricted and public use data to the RDC, so the collaborator is no longer needed to bring in separate enhanced public use files. The component PO will stay in the loop of this internal process, so there is a continuity and can provide assistance as needed, and to update our collaborators with the progress. Next. Simultaneously, on the other side, RDC analyst is assigned, and he or she will initiate the review process with the confidentiality office. And ideally, when the final approval comes, the enhanced dataset has already complete by the data steward, and the RDC analyst can readily start merging it with other non-enhanced data as needed. Otherwise, the analyst will be ready to reach out to the collaborator to collect the certificate and forms and schedule their RDC visits. Next. Hopefully, this will help clarify some of the process for you as to how to access the enhanced data through the RDC and give you some idea about the resource our division can offer to help. If you are interested in this expedited review process, please contact your component PO. If you have any general questions about the process, please feel free to contact us through the DHANS planning branch email address here. That is the dhans_pb@cdc.gov. Thank you. This is the end of my presentation. Now I'm going to turn the stage back to Lisa. Lisa?
Thanks, Jai. So now we welcome all of you to submit your questions via the chat feature in Zoom. And Brenda and I will read the questions out as time allows and try to answer all of your questions. Brenda, do we have something already? We'll give it a few minutes for you to be able to get your questions in, but if you let us know, Brenda, if there's one to begin with.
Yes, we do have a question from Maida. She asks about the RDC process in Atlanta. Apparently, they don't have access to the Atlanta RDC. And they want to proceed with approved proposals. It seems to be a staffing issue in Atlanta RDC, and she'd like to ask if anything can be done to gain virtual access to RDC data.
Yeah, I don't, thanks for asking that, Maida. I don't think we have a virtual option right now, but potentially there's something like that in the more distant future. We have, Neil Russell is ahead of the RDC, and I think he's on. Maybe he can unmute and let us know if there's any potential solutions to that, either now or in the future.
Thanks, Alan. Can you hear me clearly?
Yes.
So the issue here is I'll need to dig into a little bit more detail by what is meant by not having access to the Atlanta RDC. I don't know exactly what that means, but I'm happy to reach out to Mita offline to kind of work through those details about what the issues are and what access problems or challenges that has been occurring currently. But the NCHS does have plans to have a virtual data enclave. And we're just in the very beginnings of testing that system with a potential rollout in the spring of this coming year.
Thanks, Neil. That will be very exciting if that gets up and running. Thanks.
We have a question from Lori. The survey is not going to start till 2025 instead of 2024. So they're wondering if they could, if funding from collaborators will be needed in 2023. I guess it depends on how much pre-testing we're going to do on content. But maybe Lisa can further answer that.
Sure. Thanks for the question, Lori and Brenda. Lori, we're waiting to see. I think it kind of depends, as Alan talked about, what you missed in the beginning is the reason for that delay is the contract award process is on pause due to a protest. So we had hoped to be underway by this time, and until the protest is resolved, we are not underway and don't know how long this process is going to take. So we stay tuned. We're hopeful that we can get started soon in the new year, and that there's some work we can do towards it with 2023 funding. But we can have a conversation offline, and any others of you that are concerned about this, please reach out to me or to Brenda.
So one thing I was going to ask everyone online is another thing we've been sort of wondering about is what would make these collaborator meetings most useful for you. We want to make sure that we're being helpful for you guys. So if you're saying, I wonder why they don't do X, or I have a great idea for these, please reach out to us and let us know. We're all ears for new ideas. So please let us know.
So Raylene Lewis asked the question, will amendments to approved RDC protocols also follow the new expedited review process? Jenny?
Actually, the amendment and the renewal usually is going to be handled between the researchers and the analyst. Once the analyst start contacting you about your proposal, that RDC analyst will become your primary contact. And if you need to revise your proposal or amendment usually amendment and revision is after the original proposal is approved. Those amendment process is going to handle between the researchers and the RDC analyst. If you have some questions, we can help you to communicate, but the main communication should be occurred between the researchers and RDC analyst at that time. So that's a little bit different.
I see, Laurie, you asked about how the QC processes will be done. I'm sorry, I need a little more on that to know which QC processes you're talking about. You should be able to unmute yourself.
Okay, yeah. So in the past, we got the data and, on a secure server and we were able to run them. But now in the most recent QC we're doing, we send the code to NCHS and it's run there, and it's required quite a few additional back and forths because, sometimes you can catch little coding errors and things like that. So I was just wondering, is it in the future, is that going to be the process where code is sent to NCHS to run the QC?
This is Jai. I can answer this. This is a little bit different because for the QC in the past, you are talking about the QC for the restricted data. So for the publicly released data, the QC process is still the same. We're still sending the data set to collaborators 30 days before the release so they can do the QC for us. And for the restricted data, in the past, we go through a DAA, designated agency agreement, and that agreement in itself is quite lengthy and time consuming to get signed. And so with the current process, we actually come up with a more expedited process. Instead of we sending the data to you, you send the program to us to run, and then we'll share the output with you. And I think we could talk about this a little bit offline too, because in the project you refer to, that is quite different than our regular process, because that data set is old data set and has its specific issue. And because the specific issue with that particular data set, we have quite a few back and forth, but that's probably specific for that. I think some of other collaborators probably have the experience with this process, and we're glad to hear your feedback, but our experience with other components usually is much faster than the time we have to spend on working with the designated agency agreement. So that's probably how we would like to move forward with, but for particular process or particular data set that has more back and forth, that's probably because that data set is more complicated, and we are happy to work with you offline.
Okay, thank you very much. Yeah. I realize that ours is particular, but yeah, it has taken a bit longer than we anticipated. Yeah.
Yes.
Thanks, Laurie. Our next question, David, I believe this will be for you, from Lisa Gardner. If our data will need to be updated with each NHANES cycle release, do we need to submit a new proposal each time?
Lisa,
I
think
I think that's for Chai.
yeah, it's the RDC proposal. Hi, Lisa. So first of all, the RDC proposal is project based. So each project has to have its own proposal. And also usually we would like the project stick with the cycle they needed. So if you, for instance, we have some proposal with a report, CDC would come out with a report for every cycle of the data, and we do need a new proposal for each cycle. But within that cycle, we might have some flexibilities to including multiple analyze or multiple related topic in there. For instance, if within a cycle, we have multiple analyze for environmental report, and we wouldn't ask you to submit a singular proposal for each analyze. You can have one proposal and worded to including all the analyze and under that environmental exposure report. But for each cycle, you would need a new proposal. And unless you are doing a trend analysis, if you are doing a trend analysis, that analysis itself need multiple cycles data, which is fine.
In the chat, Lisa said, thanks so much for clarifying. Thank you, Jai. The next question is from Nancy. Would it be possible to have CDC staff do the analyses at the RDC after the investigators have approved proposals?
Hey, thanks for asking that. That's really challenging for us. We have very limited staff, and we can't really commit to, doing everyone's, analyses as much as we would really like to do that, to be honest. But it's just more than we can commit to. Really, it would basically, grind things to a halt if we were able, if we had to do that. So I think it's not something we can commit to. If there's some really extenuating circumstance, you can call us and we can talk about it, but it's not something we can promise.
Alan, I'm not seeing more come in.
Yeah, I think we can, I think we're at the end here, guys. Thank you all again. We really appreciate, we really appreciate you guys, all the work you guys do to help NHANES, and all of your support. And we want to continue working with you. For many of you, we'll meet with you, or I'll get to meet with you individually at some point, I hope. and look forward to that. But until then, enjoy your Thanksgivings, and we hope to see you soon.